Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through January 13th, 2022. This week, I'm going to continue with the same question I've asked for the last month or so, which is what is happening with the current surge, the Omicron variant associated increase, and then what was in an important report from the CDC this week didn't seem to get a lot of media coverage. In terms of the first question, I think we need to rephrase it and what in the world is going on? Because what we're seeing right now isn't like anything we've seen before during the pandemic. If you look at global cases, the highest number we saw was 800,000 or so daily cases. It's been shooting up. It's more than tripled. Fortunately, we're not seeing the same kind of spike in deaths, although we are, looks like we may be seeing an increase in the last couple of weeks. About 5.5 million deaths to date, about 6,500 deaths every day. So still a very serious problem, but we're seeing this disconnect between the number of cases and the number of deaths. We're seeing the same pattern in the United States, where for the highest peak we had before was about 250,000 cases. It's more than tripled. Again, we're not, and by the way, some have said, well, is this just because we're testing more? And the answer is no. If you look at the number of tests, we are testing slightly more than we did in the last peak, but nowhere close to justifying a tripling in the number of cases. In terms of the number of deaths, unfortunately, we are seeing a creeping up of deaths over the last 6 weeks or so. It doesn't match the pattern of number of cases, but I am worried about what the implications of this are. We're approaching 900,000 total deaths, about 1,750 deaths a day. That is up over the last few weeks. But as you can see, it's still below some of the previous peaks, though well above where it was level over the summertime. What worries me is two things. One, we're seeing a very sharp increase in hospitalizations. And what you can see is that for all sorts of age groups, the number of hospitalizations is going up very rapidly. And we know that hospitalizations happen before deaths, unfortunately. And if you look at the highest risk group, those 70 and over, you can see that daily hospitalizations are almost as high as they were in a year ago at the highest peak. And then you can see that for those 60 to 69, it's higher than it was before. And perhaps most worrisome, if you look at all of the age groups, that little brown, black dotted line there, it's higher than it has ever been. So obviously, while we're pleased that the number of deaths is not matching the number of cases, this implies that we are going to see an increase in deaths, at least in the next few weeks. The second thing I'm worried about is how rapidly this current surge is happening. This was 3 weeks ago, 2 weeks ago, last week, and this week. And you can just see this explosion. Unlike last year when it started in the Southeast and sort of moved up to the Dakotas, this seems to be sort of exploding across the eastern half of the United States and to some extent the western half. And it looks like if this pattern continues, you can sort of see that Kentucky and Tennessee may be lagging a little bit behind the rest of the country. So we may be going to see a bit more of an explosion here than in other places. In terms of what Tennessee has seen, we're certainly seeing more cases here, but not at the rate, not that 3 times greater than we saw before kind of rate. So we'll keep our fingers crossed and hope we don't see that. In terms of deaths, we're not seeing an increase in deaths yet. Though we've had over 21,000 deaths in Tennessee, we're running 2 to 3 dozen deaths a day, still a problem. But again, the pattern suggests that we're going to see more, especially when you look here at hospital admissions. And again, you can see the high risk group and all numbers are pretty much getting close to the highest they've ever been, suggesting that, again, over the next week, 2 weeks, 3 weeks, we're not sure, we are going to see increased hospitalizations and probably, unfortunately, increased deaths. In terms of the Ballad Health region, which has been a magnificent source of information, they're almost at 300 hospitalizations. Again, the second highest peak that they've had. 90% of hospitalized patients are not fully vaccinated. 95% of those in the ICU are not fully vaccinated, and almost 97% of the intubated ones. Again, data after data points show that vaccination reduces serious injury and death. And that leads us to the next topic, which is a report from the CDC that came out this week, which is really quite important, but didn't get a lot of media coverage. It was in the MMWR, and basically they looked at 1.2 million vaccinated people, vaccinated with COVID, again, in between December 2020 and October 2021. That's that 10-month period when vaccine first became available. This is a lot of vaccinated folks. And they said, what's the risk of a serious outcome, respiratory failure, ICU admission, or death, or death separately for these 1.2 million people? What's the risk? Well, if you've been vaccinated, your risk of a serious outcome is about 1 in 6,500. Your risk of death is about 1 in 30,000. So a very significant reduction in risk of serious outcome and death. But what's interesting to me, what was most interesting, is they said that every person who had a serious outcome had at least one of these risk factors. Over the age of 65, they were immune suppressed, or they had one of 6 chronic conditions: diabetes, kidney disease, heart disease, pulmonary disease, neurologic disease, and liver disease. But look at this next statistic. 78%, 3/4 of all the people who had a serious outcome once they were vaccinated had at least 4 of these risk factors. So you begin to realize that really is these underlying risk factors are what put people who have been vaccinated at risk. And they had none that had no risk factors at all. And what you can see here is this significant increase in risk of death and ICU respiratory failure for those who have 4 or more of these risk factors. The take-home message from the CDC is that these are the folks that need to be protected. Now, the reason this becomes important for all of us is people often say, is it safe for me to go out without a mask? Is it safe for me? First of all, it's not safe not to be vaccinated. But the problem with answering the question is it really depends on whether you or those around you, your loved ones, the ones you're going to be associated with, have any of these risk factors, because that's a fundamental game changer. So we really have to be sure that everyone is vaccinated, and then those who have these high risk factors are protected even more. So what's happening with the surge? We're seeing this incredible spike in cases, 3 times more than we've seen before. We're starting to see an increase in deaths, but certainly not to the same level, thank goodness. In terms of this recent report, for those who've been vaccinated, the real risk factors are older age, immune suppression, or chronic disease. Last week, I asked the question, was CDC going to update their guidance on masks? They have not done that. One report says they're not going to. Another report says they will. But at this point, they haven't updated it. So a great deal more information about COVID-19 on the College of Public Health website. Please, if you know anyone who'd be interested in seeing these videos, please feel free to share them. I'd like to thank Dara Young for editing, producing, and posting this video. And as always, if you have any questions, I look forward to getting them. You can send me an email. You can reply to this email. Please also note that we're asking you to sign up for our YouTube notification, because we're finding that some people who are getting this video in their email box, it's being marked as spam. And none of us want that, right? So until next week, I do hope that you're well and healthy. I'll see you then. Bye-bye.